Just wanted to very, very briefly review some of the NIEHS efforts in this area of the environment and obesity, as well as much of the focus here have been talking about that a good start lasts a lifetime and a bad start also lasts a lifetime. And so we held our first symposium on the fetal origins of disease over 10 years ago in 2004. Because of growing interest in the relationship between environmental chemicals, obesity, and diabetes, we put out a program announcement and funded quite a number of grants starting in 2011. We currently have funding for 57 grants related to obesity, which involves 32 human cohorts and 20 animal models and 5 totally mechanistic kind of studies. Our NTP work, and you heard from Scott Auerbach about some of the ToxCask and Tox21 efforts, show that we really need to think more broadly when we're thinking of chemicals to consider. There are many other compounds that we haven't even begun to think about that may have impacts. And I would say that we also need to be thinking about what are the alerts that we need to be looking for chemicals of concern. You know, we keep saying we can't test all the 80,000 chemicals that are out there, and of course that doesn't include natural products and so on. But we have to have a better idea for screening prioritization, at least at first. I think some of the needs that we really have is that we need to work on identification of chemicals that cause weight gain, or maybe more a better characterization would be changes in body composition, because sometimes they are very small, at least in small animals, the total weight gain may seem very small, and yet if you actually look at body composition, you may find that there's a lot more fat than there normally is. We need to really understand the windows of susceptibility. I often think that the ability to perturb a healthy young adult is not an easy thing to do, while if you have the opportunity to perturb during organizational stages in development, you're going to have permanent long-term effects. I think we need to think more broadly than just the adipocyte. And for example, the GI tract and the pancreas and the muscle and the liver, but again and again and again, we need to remember that the brain is controlling much of our behavior, both conscious and unconscious, and we need to focus on that. We need to recognize the fact that there are multiple kinds of stressors, and we heard about infectious agents, we heard about the microbiome, we heard about artificial sweeteners, we also heard about natural sugars that may be problematic. With the different chemicals, and again, it's not one chemical at a time, and this of course is a mantra that I say often, but we haven't made great strides in looking at some of the mixtures, very complex kinds of questions that we need to address. When we talk about tox studies, I think that the tox studies need some redesign as we go forward. We need to be sure we hold animals long enough to see effects, especially if we're doing developmental kinds of exposures. You know, just holding the animals through, even if we hold them, let's back up. Sometimes we only held them to weaning. Maybe if we were good, we held them to puberty and we could assess time to puberty. But we really need to hold them at least until a year of age in order to see the kinds of effects we might be looking for. And then we always should be asking the question, are we even using the right animal model? You know, I often hear people will say, this is what we find in rats. And I'll say to them, well, what rat? You know, what strain? Did you only look in one sex? And sex is a whole other issue that, oh, it's always another issue, but I do want to make the point that, you know, we shouldn't be surprised, especially when we're really focusing on many chemicals that may perturb a variety of different endocrine systems, that there would be sex-dependent effects. And so, you know, I think in the past, when we only saw something in, for example, one sex, we would say, oh, well, maybe it's not real. Well, I think we better start realizing that it is real and better understand what's going on there. The other thing about the animal models is I think that we really should be thinking about the variability in ratdom or mousedom and not focus exclusively on a single strain of animals, which may not be very susceptible for example, to weight gain. I can think of some different strains of mice. Even if you put them on a high-fat diet, they only maybe increase their body weight by a relatively small amount. And other mice, we saw some pictures or some graphs the other day with mice that ended up weighing 70 or 80 grams. I mean, that is a monster mouse. I would not want to find that under my garbage can or something. But I think we need to think about different models, and I do think that the diversity outcross or mouse, which allows you to span the genetics of mousedom, is a model that we need to begin to address. I've already mentioned mechanisms that we need to be focusing on brain and different regions of the brain. For example, the satiety centers that increase food intake. I think we also begin to think of the role of circadian rhythms. We've known for quite a while in terms of toxicology that if you dose animals, for example, at a certain time of day, you may get a very different dose-response curve than if you dose them at another time of day when it's a different time in the rhythm. And I think we need to think about that relating to obesogens as well. Lots of things can complicate where we're going, but we need to understand, for example, issues about socioeconomic status, which is very complicated. This is not just race or ethnicity. It's not just economic buying power. It includes huge cultural issues as well that we have to be considering. People brought up the issue of birth order when you talk about breastfed. Well, not only breastfeeding, but remember, if you have a chemical that is at higher concentration in a woman before she nurses, that means that in utero there's also higher exposure, because the placenta is just like the blood-brain barrier. It's not very effective. Lots of things can cross it. One thing I heard was really interesting, and I hadn't thought about how in Europe most of the women are nursing their children at least for a significant amount of time, while in the U.S. we're doing better than we were 30 years ago, but we're still not where we need to be. And part of that, I think, is the function that if women are lucky, they stay out of work for 3 months, often unpaid, and that is kind of works against women deciding to nurse significantly long term. I think the issue, speaking about women and their babies, I think gestational diabetes is a huge issue that we keep finding associations with various health outcomes, both in the woman and the child, but I don't think we really know what's going on there at all. I think this is a ripe opportunity, and I should mention that the National Institutes for Child Health and Development is sponsoring a huge new project looking at the function of the physiology of the placenta. It's going to involve a lot of imaging techniques and so on that I think may be very rich in trying to understand the impacts, for example, of gestational diabetes. I think that probably has an impact on placental function as we go forward. I was really taken by the commonalities of some of the pathways that may be involved, whether it's an inflammatory pathway and the role of oxidative stress, which of course plays a role in many, many different diseases. So I guess one thing I back up and say is when we think about obesogens, they're not just going to be affecting obesity, they're also going to be affecting lots of other health endpoints or have potential for health effects, which are going to be dependent upon the inherent susceptibility, the timing of exposures, and by that I mean life stage timing, but also acute versus chronic, and also dose, and you're going to have multiple things. But if you have a chemical that's very bioactive, it's probably very bioactive. And by that I mean that it's probably going to do different things in different tissues, especially if it's an endocrine-mediated reaction where everything is context-dependent. I think one of the things that's interesting to think about is the key role of stem cells, and we saw some data on the role of mesenchymal stem cells, especially human mesenchymal stem cells, and that they can be programmed. And I think we're finding in a number, certainly of cancer, we're finding that there are cancer stem cells, and those are the ones where kind of the, if you want to say cancer memory resides, and I think that the same thing may be true here related to mesenchymal stem cells, and whether they go to a adipocyte line or a bone cell line or something, that's going to be a permanent change if it occurs early in development. I already mentioned that maybe body weight gain is not the best metric to use, especially in the animal studies, and I think in the human studies as well. Body composition is extremely important, and so BMI may be the easiest metric that we have, but it may not be the one that addresses all of our questions, and it may be something we want to go a little deeper in there. Again and again and again, we heard, oh, I forgot one other thing. I mentioned oxidative damage. I think the whole idea of the role of infections and the role of the microbiome, I think is huge. I do think that that Israeli study that was referred to this morning, to me, was an extremely important study looking at the role of the microbiome and also suggesting or providing some evidence for potentially adverse effect of sweeteners on the microbiome. But I think we still don't know enough about the microbiome in general. All the work that's been done with the microbiome are basically, most of it is focused on the bacterial microbiome and has been characterized by looking at 16S RNA. And we don't necessarily understand the functionality of these different microbes that, are very, very important. And we're just beginning to focus on their importance, not only in their importance related to our own metabolism and our metabolism of endogenous molecules, but how they may be impacted, for example, by exogenous compounds as well. So you have an interactive system. As we do our epi studies, cross-sectional studies are mainly hypothesis generating. Sometimes that's all we can do, and if we have strong animal data and mechanistic data behind them, that may give us enough biological plausibility to go forward, but we really, really need not only prospective longitudinal studies, but I think we have to think about randomized controlled intervention trials, which I think can be ethically done in an environmental context. And it's something that we haven't done a lot of in the past, but I think especially in this area of obesogens, we certainly have the potential to do it in the future. Okay. I think one thing that we have to think about is moving not only to focus on obesity, but actually to focus more on metabolic syndrome and diabetes. And I think we heard a couple of times the fact that not all obese people are really sick, and many of them don't have metabolic syndrome and don't develop type 2 but diabetes, and there are certainly type 2 diabetics who are not obese. So it's not a simple one-to-one correlation. I think that the hepatic steatosis may be an important clue, something we should look at. Not being a clinician, we can clearly identify it by certain MRI approaches, but I don't know whether, for example, we can pick it up on simple blood tests or urinalysis as well, or at least an indication, because having to do an MRI on loads and loads of people gets really expensive. So there's clearly a need for some biomarkers related to the different pathways that we're looking at. I think the epi studies and the animal studies should be coordinated. I think we move a lot further faster when we work together. And we raise a question in one kind of line of research and then apply it and see, well, does it, where does it take us? And I think the toxicologists want to think that they're the ones finding thing, and then the epidemiologists go and look. I could say that I think it may be more the other way around, that frequently it's the epidemiologist who sees an association that nobody had ever considered before, and then the toxicologists need to see, well, is there biological plausibility here? I think clearly the econometrics is absolutely essential here. The only way that we're able to bring about policy change, at least from a regulatory role, I think, is when the dollars speak, and they speak loudly. So we know that there are a series of papers coming out tomorrow morning that are going to economize, I think obesity maybe or diabetes might be one of the topics, but I know that clearly there's evidence for neurodevelopmental impacts, although that's only one of many different kinds of effects and a limited number of chemicals that have been looked at there. I've heard that it might be nice to have a systematic review of endocrine disruption and obesity to better assess the state of the science. I've already brought up the issue of multi-causality, actually, that many things are involved. I think we want to simplify everything to the point to form a straight A goes to B goes to C. And in most cases, when I think of, for example, the, forget what you call it, that Scott showed, that with all the interacting pathways that go on. I think that's the reality of things. There are many ways you can get to obesity. There's not just one, and we need to be thinking about that. I've already said that I think something that's an obesogen does lots of other things in most cases, but I think we need to look at multiple consequences of obesity. It's not just potentially metabolic syndrome and diabetes. There are issues of effects on, for example, orthopedic load, cancer, and so on. We need to think more broadly. And, of course, effects on the next generation. The paradigm we have for obesity in this country is one of treatment, intervention and treatment, and I'm not saying we don't need to continue to improve our ways to do that, but how much better to prevent in the first place. And that's going to have to start not only in children, but actually prenatally and maybe even preconceptionally. And I think one interesting point brought up by Bernie and a little bit debated at Bernie Goldstein towards the end of the day was the issue of co-benefits of weight loss. What else goes along with that? And that if we talk about better food, it may also cost more, but although then there was discussion saying, well, it doesn't necessarily cost more, but it is issues of convenience and availability. And as I said when I started the meeting off yesterday, I'm not giving anyone a buy on exercise and diet, but are we making it harder for people to control their weight? I think that's the question we need an answer to. So.
Suzanne, can you hear us okay?